If you're here to see the scar, you have to wait until the end. Welcome back to my channel. This is Makeup Maria from Miami. If you're living your best life in your mid-plus years, or you love skincare and makeup, this is the place for you. Okay, so today's video is about skin cancer. I'd like to start off with a few disclaimers. I realize that there are folks out there dealing with cancer and other health issues that are much more difficult, but I think it's important to tell people out there, especially a lot of young people that watch beauty YouTube and skincare YouTube videos, that this is a serious thing, and I'm going to talk about some of the superficial and annoying issues and financial issues. I think that whatever convinces you to use sunscreen and to protect yourself from skin cancer, do it. So if it's being vain and you don't want to age your skin in the sun, fine. If it's superficial, that you don't want if you don't want skin cancer scars like the one I'm going to show you, fine, whatever works. The reason for doing this video is just to get the word out there about a lot of the different reasons why having skin cancer is a pain in the butt. Of course, again, it's not as serious as many other cancers, and I don't mean to diminish what some people are going through, but this is my experience, and that's why I just decided to share it. So, in case you're new to my channel, I did release another video, my first video about skin cancer and what I went through, and I'll link that below in the description box if you're interested in watching it. This time, I want to talk about the annoying things. That this is my second time around with skin cancer, and I just wanted to spell out some of the things that were particularly annoying during this process. So the first one is the cost. I'm very fortunate to have health insurance to be able to pay for the health costs, but seriously, it's not like I'm rolling in dough. I would love to spend this money on something else. It has cost me thousands of dollars, and I would much rather put that money towards retirement, my home, a nice trip. And so it's annoying. Again, I'm fortunate. I have health insurance, and which covers the bulk of it. But nowadays health insurance doesn't cover everything. You have huge deductibles, so you still end up paying a lot out of pocket. So that's the first thing, is annoying. The second thing is the risk, and that is obviously a lot more scary. Because basically what happened with me is both times there was something on my face that I didn't think was skin cancer and didn't think anything of it. And only because my daughter told me to go to the dermatologist did the dermatologist do a biopsy. As a matter of fact, the dermatologist didn't think it was anything at the time. But then after the biopsy was done, I got that fatal call saying, hey, it's cancer and we need to remove it. So the second time, it was the same thing. It was this time I had something and I wanted it to be removed for superficial reasons. And again, the dermatologist said, I don't think it's anything, but we'll certainly remove it and we'll certainly do a biopsy. Again, I got the call that it's skin cancer. So, and that is really, really scary, because you don't know, maybe you missed these two, maybe there are others that you're missing. So you get a little paranoid and you get a little afraid. And then just scheduling the surgery, if it gets postponed, which mine did, I, freaked out a little bit, called my dermatologist and said, hey, what's going on? I mean, this was postponed, is this serious? And, should I do something about this? And they told me, no, this is very superficial. You don't have to worry. If it's postponed, you can have it. Nothing's going to happen. And so that's what happened. But still, no one wants to go through that. And again, this is not as serious as many other people's situation with cancer, various forms of cancer. But again, this was what happened with me, and this is what might happen with you if you have to go through this process. And then, of course, what we're going to talk about today is the scar. This one is going to be a lot bigger than my first one. My first one is both. It's all on this side of my face. I just realized that. The other one is right here. I don't know. I don't even think you can see the scar anymore. And then this one is here. This one's a lot bigger. And when they do the surgery, by the way, they'll keep cutting until they don't find cancer. And so with both times, they had to go in twice, which is, again, something that, gives you a moment of pause, because that means that the surgeon had to dig twice. And so you don't want to get in a situation where they're going to continue digging, because obviously you're going to have a hole in your face, and then you may require, some plastic surgery if you can afford it. It's a lot, and you don't want to have to go there. And so that's something else that's, a little nerve-wracking about the whole process. Next thing that is a huge annoyance, and probably the thing I'm most concerned about, is the risk to my daughter. I have a son and a daughter, but my daughter is older, and she was the one that was out there in the sun with me. We would be at the pool and at the beach all summer. I live in Miami. It's beautiful weather. We didn't know anything about sunscreen, and so I put her at risk. So that's something that I'm going to be after her to make sure, and I am currently after her to wear sunscreen. She wears it now every day because of me, but I'm also going to have to, keep an eye on her like she kept an eye on me. So that was another thing that, again, I don't want anyone else to have to go through. There are many wonderful sunscreens out there. Dermatologists and estheticians, why can't I say that, provide great information on YouTube and in articles. It's just out there for you if you want the information. There's good sunscreens that are wonderful underneath makeup. There are some that are good, if you're out and about, because you need to have something that's pretty strong if you're out in the sun, if you're going swimming or you're going to the beach. You need something that's at least 50, and you need a plus, you need to reapply. So I'm going to show you some of my favorites and some not so favorite. So this is the one that I use when I'm not wearing makeup. It's the Color Science Glow 50++. And this was a recommendation from Dr. Dray, she's a dermatologist, and she has a YouTube channel. It's very glowy. So if you don't like very glowy, you may not like this. I like it because I'm mature, I have dry skin, and it sticks to your face. You can feel that when you put it on, it's a little bit thick, so you know that this thing, is not going anywhere. It doesn't budge. So this is a mineral sunscreen. It's very powerful and it works really well. I don't wear it under makeup though. I don't have it with me, but the one I wear and I've talked a lot about is the Cate sunscreen / primer, and I wear that under makeup because it's tough to wear sunscreen under makeup. And that one is beautiful. It's very expensive. It also has some skincare ingredients, and it has some primer properties, and I love it. I've bought multiple bottles, and I just think that fall in love with your sunscreen. Find something, if it's a little bougie, if it's a sunscreen primer, if it's, whatever works. Again, find a sunscreen that you can fall in love with, and because that way you'll use it. I also use this powder. This is the Color Science Broad Spectrum SPF 50 Brush On Sunscreen. And this is very nice. The only problem with this is that it's tough. It comes with its own little brush. It's hard to get out. Like, you really have to do a lot of, and then the brush is not fun to put on. So it'll mattify your skin a little bit. It's a nice powder though. It is a really nice powder. I'm probably gonna put this in a pot, take it out, and then that way it'll be easier to use. The only thing is this is portable, so that's really nice. So mixed feelings about that. Anyway, for another facial sunscreen that's very good is Supergoop Glow Sunscreen. This is a chemical sunscreen. It's broad spectrum 40 PA+++. It's very similar to the Color Science. It's very glowy. It's got a little tint. I think you can get it without tint as well. It's just a teeny bit thinner than this one. I think they both work pretty much the same way. This is chemical sunscreen. This is mineral sunscreen, and they're very, very similar. If you can wear mineral sunscreen, it's going to be better. But again, whatever works for you. Chemical, but the problem with mineral is sometimes there's a white cast, and so that's not fun. And this one it's a little lighter texture, but it's also glowy. Also has a tint and less of a white cast. They're both good. I don't know if this one's good under makeup. I haven't tried it under makeup, but they do have another brand that's like Unseen or something, Supergoop, and I think that might be better for under your makeup. But do your homework, watch your YouTube videos, go online. I'm sure you can find a sunscreen that works for you. Definitely try to avoid the spray on sunscreens because there's been issues with benzene. It's a carcinogen that has been found in sunscreens. But if you stay away from the spray on products, you should be okay. But there is information, and I'll link it below, where you can look up your sunscreen to make sure before you purchase it if it's the ones that has benzene in it. I like this Hydro Boost Neutrogena for the body. This one is no good. I'm gonna have to throw it away. I'm gonna keep it maybe for an empties video, just because once you open it, sunscreen is only good for about 6 months, and this is more than 6 months old, so I'm gonna have to purchase another one. But don't open your sunscreen until you're ready to use it. So that's another tip. So I've got this. It's a blush and lipstick sunscreen, which is nice. You know, I don't think this is like the best product as far as application, but it's nice. It's not bad. It's a nice color. This color is blush, and so you just, you know, put a little bit on, blend it in with your finger or with and it works. It's nice. It's not bad. I don't like it on the lips. It's a little drying for me on the lips, but you know, any makeup that has sunscreen, I'm all for it. So Color Science can be pricey, but I think that, you know, they're very effective, so I like it a lot. Here's one Color Science product that did not work for me. It's the Color Science Eye. This was very popular on YouTube a couple years ago. This is no longer any good because I opened it and this is old now. But this never worked for me just because it was very drying. You're supposed to put it under your eye. It has this little thing, and it's a nice salmony color, which is good. I don't know what happened to me. Which is good as a color corrector for your under eye, but no, did not work for me. So I honestly, it was very expensive and I didn't use it. So I don't recommend it if you have mature skin. I have the Shiseido, and this came with a product with a bundle of products. And this is a nice, but again, I felt like it didn't do anything. I felt like it wasn't moisturizing. Maybe it was protecting me from the sun, but I basically use my face sunscreen under my eye. I don't use a particular sunscreen for under eye. I do like their other eye cream. I love it very much. It's one of my favorites. Actually, I've repurchased it a couple of times, but it's not this one. I'm not. It's there. I'll use it, I guess, in a pinch if I need to. It's good to take on vacation, extra sunscreen, but again, you know, 6 months. So, and this has the expiration on it. So that's good. So this expires. It's no good anyway. Another reason why I was interested in doing a sunscreen video is because I watch Brit Clarke. I'm obsessed with live stream videos right now. First, it was Cate the Great Beauty, who does amazing, hysterical, very entertaining live streams. Then I started to watch Brit Clarke's live streams, and they're equally entertaining, a lot of fun. And I heard her a couple of times talk about how she doesn't wear sunscreen. She has a very strong following, and even though a lot of the people in her chat were talking about how she should wear sunscreen and that they wear sunscreen, I just think that it's really important as influencers to consider wearing sunscreen and talking about the importance of wearing sunscreen. So if I'm gonna tag her, if she sees this, I'm a big fan, and I hope that you consider wearing sunscreen, finding a sunscreen that works for you, and telling your followers, and that way you can get the message out. So anyway, that's my commercial to Brit Clarke. Okay, so let me explain the process a little bit as far as the surgery. You go to the dermatologist, they do a biopsy, you get the call saying you have skin cancer, you need to get it removed. You have two choices. You can get Mohs surgery, which is actual physical surgery where they cut out the cancer, or you can have a series of pinpointed radiology, it takes a lot longer. You have to go a couple times a week for about a month. I opted both times for the surgery. Okay, so you make an appointment, you go, and surgeons that do this, they do I asked my surgeon, and she said she does about 8 a day. So It's very routine for them. They get you in, they give you an injection in the area, they numb it, and then they go in and cut it out. Then you wait for about 20 minutes, and the lab comes back with the doctor needs to go in again, or the doctor doesn't need to go in again. What happened with me both times, the doctor needed to go in again and then cut more, and then again you wait another 20 minutes, and then at that point, both times I got the results that there was no more cancer and I could go. They have stitches that are inside that she puts in and stitches on the outside. So the stitches on the outside, you can imagine, looks pretty much like Frankenstein stitches. And so what you do is you have to put a bandage on it, and you have to clean it twice a day, and you get your hydrogen peroxide and your Vaseline ointment, and you keep it covered. So then a week later, you go back to the surgeon and they remove the stitches and take a look at it, clean it up, and that's when they put this little Band-Aid on it. So this little Band-Aid, this was on Wednesday, today is Sunday. So this little bandage has been on, and the nurse said that it should fall off by itself, but of course it hasn't. So I decided to go ahead and do the unveiling and help it out. I want to remove it because it has been several days, and I think that it's not looking that good. So I would like to put a little bandage on it and put some more hydrogen peroxide on it so it can continue to heal. So, okay, this is it. I gotta say, I'm a little nervous. So I've got my hydrogen peroxide, I've got my Q-tip, I've got my little sterile pad, and the little Band-Aid thing that they give you in the office. And so I will have to use a mirror to see. I'm going to see first, and then I will show you. So here goes. Oh boy, okay. So, oh, lovely. Wow, it is not cute. So put that there. She put 2 bandages on there. Wow. Okay. Wow, I knew it wasn't going to be cute, but it really is not cute. There it is. Okay, so I have a verifiable hole in my face. So that's it. I'm going to cover it up. I'm going to put some hydrogen peroxide and cover it up, and I'll be right back. You gotta look at the scar. It is not cute. I'm gonna have to keep a bandage on it for a while because it actually, hides it a little bit. So, yeah. Hopefully this will convince you to wear sunscreen and protect yourself. Wear a hat. Don't go out in the sun midday. Do what you're supposed to. So, thanks for watching. If you have any questions, please leave them below. If you have your own experiences with skin cancer that you care to share, please go ahead and do that so we can all continue to learn together. Thank you for watching. Wear sunscreen.